Serving all of San Diego, this is your Fox 5 News.
Good morning. Well, we're talking about a medical this morning, how Botox treatments are helping to cure migraines. That's all coming up on the Fox 5 Morning News.
All right, so Botox is known to help eliminate those fine lines and wrinkles, but this morning Heather Ford shows us how it's curing a lot more than just that.
Yeah, she's live for us at Scripps Hospital in Encinitas with the details. Good morning, Heather.
Good morning to both of you. And that's right. We're talking about how Botox is helping to treat migraines, not just headaches, but severe migraines. And to help us talk a little bit about it is Dr. Andrew Blumenfeld. You're here with us. And I want to know a little bit about this because we're not just talking about your average headache. We're talking severe migraines that disable a person from living their everyday life. How severe are we talking?
So these patients are very disabled. They're unable to function at work or at home. They have a lot of nausea, vomiting, sensitive to light and noise. And they basically, when they have a migraine attack, they're curled up in bed, unable to move.
Right, and we're going to talk to some of those patients later on this morning. I want to take a look at some of these diagrams here because I think a lot of people, if they first heard what you're giving patients Botox to treat migraines, it could be a little controversial. So how does this actually work and what's the history behind it?
So if we have a look here, what I've set out here, this is a model that shows some of the nerve endings that are supplying the skull. And these nerve endings feed back into the brainstem. And this is a very active area during a migraine attack. So when we're injecting Botox around these nerve endings, we're actually dampening down this activity that goes into the brainstem. And we're able to control the migraine headaches for 3 months at a time.
Wow.
So the nice thing about this treatment is that we do injections, but it's only every 3 months. And it'll quieten down that brain activity for all of that time. So you don't have to remember to take a medication every day, which is the previous method of preventing migraines from occurring. You'd need to take oral tablets daily.
Okay. All right, so let's get over here because I want you to show sort of how this all works. I've never been around, this sort of setting and Botox and how it all works. I want to talk to Sadie as well because you're young and you're getting Botox, so I'm sure a lot of maybe older women or people who you get advice from are saying, wow, you don't obviously have wrinkles, so you don't need it. But what's your background and what were your migraines? How did you start getting migraines?
I never had migraines before. I played college soccer, and I actually got a head injury while I was playing. And after that, I had seizures, and then from that, I also had migraines.
And this has helped?
This has helped a lot because I couldn't take a lot of medications because of the seizures. It didn't mix with the seizure medication, but I would wake up every morning like throwing up or having to close my blinds. I'd go to work and like run to the bathroom throwing up and not being able to like open my eyes. It was just really hard for me to do normal things.
Right. Okay, so doctor, what I want to do is later on in our later hours, we're going to show where the injections are and the sites because it is much different than if you would get it for your fine lines and wrinkles and all of that. So we'll show how many injections are there, how many different sites?
So we do 31 injections around the forehead, on the temples, the back of the head, the neck, and the shoulder regions.
Okay.
And these are all the nerve spots that are feeding into that brainstem. That's where the activity is.
Okay, so coming up, we're going to show that as well as talk about some other disabling problems that the Botox is helping out with. That's all coming up in our later hours. For now, I'm going to send it back to you guys in the studio.
All right. Thanks so much, Heather. We appreciate it.